Thank you very much, Doctor, for this kind introduction. I'm covering for Dr. Eid, but Alhamdulillah, my esteemed member of the committee are here. So I'll just give you a brief on what the Ministry of Health has been doing when it comes to severe asthma program under value-based healthcare under the Ministry of Health. And one of these projects was the severe asthma. So I'm just giving you some briefs and some insights on the severe asthma registry run by the Ministry of Health. So we started, first of all, evaluating these multiple biologics and introduction to our formulary for the management of severe asthma in June 2021, and then the introduction of or the establishment of the registry of severe asthma was live on January 2022. First enrollment of our patients for biologics was in May 2022. And then our steering committee has some insight in even creating sub eligibility criteria for patient enrollment. So, first of all, why are we doing these registries in the Ministry of Health? It's very important to implement, and it's the key driver for implementing such value-based programs to follow up patients and understanding how are those patients managed and their outcomes and their adherence to these medications. And then to collect even real world data and evidence when it comes for these new, relatively new medications, and we'll be ready for any new interventions that will be coming in the pipelines. So currently we have more than 300 plus patients that mean captured in our registries, and more than 27 train sites. 23 of them are recruiting sites across 18 regions in Kingdom of Saudi Arabia. And these are just two screenshots on the number of patients who are approved and being linked to the medication or one of the biologics, which is beralzumab. So this is just a screenshot of multiple, let's say, insights, and this is available for all our physicians, consultants that are prescribing these beralzumab, so they would be able to follow the patient, knowing what the number of patients that they are following up, the duration, and what is the outcomes that their patients are getting after linking them to certain these medications. So you would see the distribution of patients by gender, by age, by diagnosis, or even by cities and facilities in the kingdom. So we would know that different facilities or different region might need more services than other, whether it's a consultant or whether it's a clinics, in order to upscale these centers. So these are the standard eligibility criteria for beralzumab for adults with severe asthma. So definitely they will be diagnosed, and they are with a medium to high ICS and LABA for the previous 12 months, and then the severe eosinophilic diagnosis, then the history of having more or equal of 2 exacerbations. And then we need to make sure that the patients are adherent. And in the Ministry of Health, we are setting the adherence to 80%, knowing that it's not a clinical trial, it's real world setting. So we make sure that it's the threshold of 80%. And then we follow up the patients, and patient who will be able or who is eligible for refilling, which is after 12 months, we need to make sure that their exacerbation are reduced by 50%. Our setup of this registry and the committee is a bit unique. So we tend to meet every week, and we are introducing even or inviting different consultants to the meeting in order to discuss these cases. If these cases need certain negotiation or discussion of new, let's say, information that is raised from the prescriber. So as I said, our set criteria of patients who will be labeled as responders to benralizumab. So we need to make sure that it is decreased, the number of exacerbation is decreased by 50% from baseline, and this reflects the decrease of ER visits and hospital admission and the OCS utilization. So currently, we have 196 patients that's still ongoing on benralizumab. 4 of them were dropped out, and we discuss these dropouts, whether they are a consultant request or the committee request, or the physician, the patient just wanted to stop the medications. And then we injected the patient support program to make sure that the patient understand how to use these medications, follow up those patients in their refilling, in their appointments, and if they have any concern or question, they would know where to go. So we are having a close contact with our patients. So you can see here that we reached 87% of patient adherence to their medications simply by following up the patient and checking with the pharmacy and their prescription or dispensation of their medication, and injecting, as I mentioned, the patient support program as well for all our cities. Okay, so currently what we have about 76 patients that completed the journey of more than 12 months. And now these are the patients who we're discussing their outcomes. As you can see here, these are the number of every patient, whether their baseline from number of exacerbation before and after, and linking them to benralizumab after 12 months. And you can see here more than 80% of the patients had reduced more than 50% of exacerbations, of their exacerbations. 19 patients achieved only 50% reduction, which is about 20% of our patients, and less than 5% who did not achieve the reduction of about 50% of their outcomes. So this would really show us the either the population and how is this medications being the action of these medication within our patients, and the outcome of these introduction of these patients, knowing that we are going to evaluate or having our second evaluation, inshallah, by Q3 this year, reviewing the already available established indication and the newly added or registered Saudi FDA medication. So we would also negotiate with the pharma different endpoints that we want to see, knowing that these are our outcomes and this how our patient is being achieved their outcomes from the introduction of these biologics. And definitely, one of the elements in the financial part, whether the patient is considered as patient responders or failures. So within the only 78 patients, we are estimating to have about 4 million Saudi riyal in savings, and these are translated to be FOC product or extra product to our patients. And by this, I end my presentation. Thank you very much. If you have any question, تفضل.
Because really, biologic used in many centers, and we have, some kind of deficiencies in national registry.
True.
So this will be a good opportunity since you already set the scene.
Of course. From the concept, we are currently having 2 national registries in the Ministry of Health, these national registries is linked to medication. One of them can SMA, with the other is retinal dystrophy, and these medications as well being paid by the Ministry of Health in order to just make sure that the similar eligibility criteria and so on. Now, the platform being utilized will be more than happy to open this platform for different institutions, for them to utilize this platform, and for us to have to guide the nation later on for a really informative decision when it comes to a national level, rather than having the Ministry of Health that covers 60-70% of the population. But the concept of it, we are more than happy to share these platforms with you. Thank you. Further.
Thank you very much, Dr. Hajer. So my question is about the exacerbation. So, the exacerbation, is it that what the clinician has filled the form and say the patient
Yes.
had exacerbation? Yes, no, right? Because sometimes if I'm the clinician and I am just worried that if I say that the patient had exacerbation, then they won't get the medication. I might just say the patient had no exacerbation.
Yeah.
So whether there's any way of tracking those patients by their admissions
Yes.
and ER visits.
Yes, I think Dr. Abdullah Asiri might respond to this question better than I can.
Actually, we have the patient support program,
Yes.
and they are sending to each center a monthly report about the patients. What about the ACT score? Is there any ER visits? And is there any use of oral corticosteroids? And based on that, we are identified this patient as an acute exacerbation. Fortunately, that Asir Central Hospital is the highest number, as you see. And I think we are reached to approach 100 patients by the end of this year, inshallah. The response rate is amazing. Among this, now we are having around 89 patients. Only 2 patients, they are not responding.
Yes.
Because of severe nasal polyposis, and they still have exacerbation. They have reduction in exacerbation by 50%, but still they are using, they have 2 or 3 exacerbation.
Yes.
Some of patients, for example, we have one patient, he has 10 exacerbation.
Yes.
And now he has 0 exacerbation.
Yes.
His FEV1 improved from 41 to 69. We have another patient, he was admitted in 3 months 4 times because of severe asthma exacerbation. And now this patient is start to exercise in the gym and as a body lifter. So what is happened for those patients is amazing, and the change in the life and their life is amazing. So regarding those patients, we are strictly follow those kinds of patients by the patient support program. And fortunately, those health educators that they are following this patient, you can access them at any time. And you can ask, please, this patient, tell me what's happened for them. Yes.
Thank you very much, Dr.